What's up, everybody? Welcome to the Shay McCray Show. I'm sitting here with nurse practitioner Mellisa Pauline. How you doing?
Hey, how are you?
I'm good. No complaints.
Great.
Look, we over here like we trying to keep warm.
I know.
Right? Yep. So, not only are you a nurse practitioner, but you also practice holistic.
Yes, with my wellness clinic.
Yes.
It's called RejuvenateU Wellness Clinic.
Okay.
We are located by the Mall of Georgia, where we do medical facials, medical weight loss, IV vitamin therapy, and hormone replacement therapy.
Okay. Okay. Nice. So let's back up. You said you own a clinic.
I own a wellness clinic.
Okay, wellness clinic. Okay, and let's talk about that a little bit more. How long has it been open?
It's been open for going on 4 years now.
Okay, and what's the name?
RejuvenateU Wellness Clinic.
RejuvenateU. And what are some of the things, the services that you guys provide there?
We do medical facials, so
Okay.
hydrofacials, acne treatments.
Okay, so now the hydrofacials, is that where they pull the dead skin off and?
Correct. So it's
Okay.
like pretty much like a 14-step process.
It is?
Yes. So it's more than a regular facial, but
Okay.
we kind of go deeper than skin deep, and then we go into the pores, remove the dead skins, do dermaplaning.
Yeah. Why you gotta look so ugly for like a couple days? Like,
I mean, you have to get rid of the dead before the beauty comes out. It's unfortunate.
So
But it's not that
14 visits or it's 14 steps?
14 steps within that one visit.
Within the one,
Yep,
but
so
you
it's
still
about an
got to
hour.
come back. Okay.
Yeah.
All right. And then how long does the healing process last for?
About 2 to 3 days.
Okay. It's not
About
too
2
bad,
to 3
right?
days. Yeah, it's not bad.
Yeah, because you have beautiful skin. So
thank you.
do you perform these services on yourself, I'm assuming?
Not me. I have an esthetician.
Okay.
That she performs the services on
Okay.
me from time to time, because I'm like, if I'm the owner,
You got to make sure
I
to
have
keep
to
it
make
right.
sure to
Okay.
make it right.
Now, you also provide IV.
IV vitamin therapy.
Yep.
So that's just like you taking one a day, every day for 30 days. It takes 30 days for the medicine to build up in your system for you to actually get the full effects of all the vitamins.
Uh-huh.
What I do is we put all those vitamins in a bag of fluid, put it in an IV, go through your bloodstream, and you get the immediate effects.
Okay,
instead
so
of
I
waiting
do have
30
a
days.
question with that because I do suffer from anemia and I've been hospitalized a couple times, need iron and blood and all that.
Transfusions.
And someone told me to try the IV.
Correct.
But y'all don't do iron though. They told me they suggest
We don't do iron, but we do vitamin B12.
They did say that.
Yes.
Is that something that would help with someone like myself to help build my iron level? Because I have an issue with absorbency.
Yes. So what the problem with your absorbency is that it has to go through your GI tract.
Yep.
So you need IV fluids. So IV bypasses the GI tracts and goes straight into your bloodstream. So that's what's going to help you more than anything else.
Okay. But how would it help if there's no iron in the B12?
Because B12 helps with red blood cell production.
Okay.
So the red blood cell production
yes.
is what brings your hemoglobin up.
Okay.
So yes.
All right. I love it. Okay. Because they recommended it, and I got nervous because I was like, I've never had that before, and of course we stick to what we know because we know what would bring us back up. So I just want to, you have
to try it. I have a couple of clients that are anemic as well.
Okay.
And what they do is they do get their iron infusions, but they come to me every 3 to 4 weeks and they get, replenishing of their B12, and that has helped them keep their iron levels up.
Okay. Okay. All right. I now you made me a believer.
It works. I promise you. I've done it myself.
You've done it yourself?
Like
Okay.
I've been feeling drained and fatigued, and I get, my little pick me up, and I get that boost to keep me going.
Okay. What are one of the I notice a lot of times people might drink and they come see you guys. I hear that.
That's the hangover drip.
That's the hangover drip?
That's the
Okay,
hangover
let's talk about
drip.
that.
So the hangover drip, what it is just B vitamins, your minerals like your calcium, magnesium, vitamin C. It's all in the bag, but then we also add Zofran, which is a nausea medicine. So whenever you're hungover, you get nauseous. So we put all that in the bag and then we infuse it, and about 30-40 minutes later you're feeling brand new. What is the most common IV injections you guys do?
Our common one is called the Reboot. It's the Myers cocktail, which is the original IV drip. And that has all
the same as your multivitamins that you do once a day, but that goes in a bag, and that's our most common because it helps you with all types of different symptoms.
So with that, do you still take a multivitamin or no? Okay.
You don't have to.
And how often do you recommend that you do the drip?
I would say every 3 to 4 weeks. The vitamins circulate in your system for about 3 to 4 weeks. So every so often you can go back and get replenished again. Okay. But it does work.
Why not take a liquid vitamin if that's the case versus?
Because in order for you to get 100% of those vitamins, your GI tract has to be pristine, which means you have to clean eat, you drink a lot of water, you can't divert from your diet, right? Because it has to be digested through your stomach, through your through that system. So with the IV, it bypasses all that. So it goes right into your bloodstream and circulate through your body.
Okay, makes sense. So you lose some nutrition by taking it by mouth. Not that it's not bad.
It's not that it's not good. It's just that you want 100% of what you're getting, and that's the only way you can get that.
Okay. What are your thoughts of some of these other brands out here that promote like a liquid vitamin, like for example, NutriBurst and some of those type of brands that's
I mean, they work. I'm not going to say that they don't work because I used to do NutriBurst. I used to take NutriBurst as a supplement.
And help you lose weight too.
Right. I'm not going to say that it doesn't work, but I would say that the IV form is more effective, where you're going to get 100% of it, and you're going to feel it that much quicker.
Much quicker. Okay. All right. So you also do weight loss?
Yes.
Okay.
That's a phenomenon.
Okay.
The medical weight loss. I don't know if you've heard about it. Ozempic, Wegovy, semaglutide.
Okay.
It works.
Okay.
It works.
How do you feel about it, especially with all the right now with the side effects that some of the people are having?
I love it, and I recommend it for those that need it.
You do recommend it?
I do recommend it.
And why?
And the reason why I recommend it because I've done it myself and it works.
Okay.
I've lost 12 pounds in 1 month because I wanted to try it before I went ahead and introduce it to my clients. What I do tell people would be,
not to cut you off, but with the proper eating and dieting and with the exercising, you can lose 10 pounds in 1 month.
You can, but sometimes people just need to see that scale move. They just need the little glimmer of hope to say, okay, I got this. And this is what this medicine does. It gives you that glimmer of hope. But I do tell my clients that you have to do 3 things with it. Okay. This is not a magic pill. It's not a magic shot. You still have to do work. You have to eat right, change your diet. You have to drink enough water because people don't drink enough water. Yeah. They have to drink at least 8 to 10 bottles of water a day. And they also have to exercise.
So you still have to do those things.
You still have to do it, but this helps accelerate the weight loss process.
Okay.
Because sometimes people, they'll eat right, eat clean, exercise, drink the water, but they just still plateau and they still have a hard time getting that little bit of weight off. Yeah. But this actually works. I just tell my clients and I tell the customers that are out there, make sure that you're with a proven professional and you're getting the medication the right way. And that's what's happening. People are not getting it the right way.
So with, I know you're big into health. I see that with the IV drip, the weight loss. What's your thoughts of plastic surgery, cosmetic surgery?
I mean, cosmetic surgery works for those that want to go through the recovery period. I actually thought I wanted to do it until I started opening up my business and I started doing post-op care, and I'm like, ooh, yeah, no.
You do post-op too? Okay, all right.
So I do post-op care where I collaborate with a lot of the estheticians and the massage therapists in the Metro Atlanta area, and they'll send their clients to me that need have medical issues. Like if they have like an incision that looks like it's infected, they'll come to me. So
how you feel about touching that? I work with someone that have an infection or something due to, I'm assuming they went to DR and got this work done.
But that's the problem. Everybody needs help, right?
Yeah.
Because I mean, you're not going to go to your primary care doctor. They're not going to touch you because
they're not.
I'm not the one that did the surgery.
Exactly.
I'm not going in there and reopening and suturing things up, but I can prescribe you antibiotics.
Okay.
And refer you to the appropriate place to go.
Okay.
You know, I mean, at the end of the day, yes, the reason why people go out of the country is because it's cheaper than what it would be in here in the US.
But it's the aftercare that we're.
And I think that's what happens. A lot of people think about the before. They think about the before, and they save
think about the results.
They save up all their money to have surgery, and they think about the results, but they don't think about a lot of the aftercare. And that's where a lot of people get stuck. Like, if I have this surgery and then I go back home to the U.S., who's going to be able to take care of me if my incision opens up or I need my train removed. Or so I'm kind of like that liaison between, you know, their doctors out in another country and their doctors here.
Well, I know it's a HIPAA law, but what could you give us a little insight? Some like maybe the worst thing you have seen someone coming to you?
Lipo burns.
Lipo burns?
Lipo burns.
Really? And what is that?
So lipo burn is like if
I'm just cringing because it sounds crazy. I'm like
a lot of clients get liposuction and they use like this suction, this wand that sucks all the fat out. And sometimes if you do it too aggressively, it causes like a burning on the top layer of the skin.
And it creates a hole in the stomach. I heard about that. I had a friend that suffered from that. No doctor would touch her.
Right, none.
Yeah, none.
They're not going to touch somebody else's work. I mean, I do get clients that come in and I recommend like Silvadene cream, which is the cream that you put on for burns.
Okay.
If it doesn't look infected, then I wouldn't, you know, offer like an antibiotic, but I would just give them I would show them the right way of handling care when it comes to stuff like that.
Okay. Whew. All right. What's some of the other services you provide?
We do hormone replacement therapy with pellets.
Okay.
We do it for men and for women, and it helps just disseminate your hormones evenly. So it's pellets that are placed right under the skin. And within like 3 to 4 weeks, it just kind of evenly distributes hormones. For those that are having problems sleeping, memory fog.
So for men, I didn't know they get hormone pellets as well.
If your testosterone level is too low, you can get hormone replacement therapy.
Really?
You'll be surprised. Men do a lot of things. We're just not privy to it. But yes.
Yeah. Okay, so for my men, what are some of the services they could get? Because they probably don't even want to talk about it, or probably fear going to their wife or their doctor saying, hey, I'm having this problem, but this is, you know, I need this fixed. What are some of the things you fix for men?
Well, I mean, it's the same. What I do for women, I do for men. I do the IV vitamin therapy for men. We have a lot of like athletes, MMA fighters that come in after the fight, before the game, to replenish their bodies, give them some fluids before that. I've had men get liposuction, and they've come in for lipo burns or seromas where they get like fluid collected under the skin, and I had to drain that. Men come for weight loss. You'd be surprised how many are injecting semaglutide and you think they're going to the gym. So I mean, the same thing I do for women is the same thing
without telling us.
Right. I mean, our services are interchangeable for men and for women.
I got you. Okay. Yeah, because I mean, it is a challenge, you know, going to the gym. It is. I'm not gonna lie. What are some of the things that you see that someone might have done that you don't recommend? And you look at them and you're like, why did you do that? You know, or something like that. I don't know.
I mean, I think a lot of my post-op clients that get liposuction and BBLs and all that, I mean, beauty's in the eye of the beholder.
Yeah.
Right?
So I'm assuming you seeing this is what made you change your mind.
Correct.
Okay, go ahead.
It's like a lot of the post-op care that's not done correctly.
Yeah.
A lot of complications happen. Like they show you all the good things that happen, but they don't really show
the
you
results.
the results. They don't show you what they go through to get to those results.
Yeah.
And it's hard. It's a lot. So that's really what changed my mind. I was just like, oh yeah.
Do you provide? I know that they also have this thing that's non-surgical. Do you do any non-surgical cosmetic?
No. So that would mean like body contouring.
Yeah.
Like the lipocavitation.
Yes.
No,
yes.
we don't.
You don't do that. Okay. Because if you're doing you do the
wood therapy?
Yes.
That's a lot of work.
She said I'm not doing all that.
That's a lot of work. There's a lot of offices in our area that specialize in that. And I was like, I'll give you guys that, because it is a lot of work.
Yeah.
It's like the wood therapy, and you have to be aggressive and you have to go at it for a good 15, 20 minutes.
Yeah.
And I was actually talking to a colleague about that. I'm like, you're doing all the work and then they turn around and go to Chick-fil-A afterwards. You're like, why did I just do all that?
No.
Yes.
I like Chick-fil-A though, but we're not gonna go there. Let's talk about the holistic practicing that you do. Yes. Okay.
I just think that, I mean, it's more so holistic, and we don't prescribe like conventional medication.
Okay.
I feel like the IVs help for all different types of reasons: migraines, high blood pressure. We even have drips for patients that have cancer.
Really?
They can get like high dose vitamin C. Instead of going through chemotherapy at their own discretion, and if that's their choosing. They've shown, when you look at tests and articles and research, that the vitamins work a lot better than you actually have in conventional medicine. But I mean, in this day and age, that's what they push to you. You have high blood pressure, take this medicine. You know, diet, exercise, drinking water, increasing the magnesium that you take.
It sounds so much easier saying it than doing it, though. You know, everybody wants a soda. Or
It's a life, but you know what? It's a lifestyle change.
It's definitely a lifestyle change, and with every I mean, right now what we're looking at 80% of Americans suffering from obesity.
Right.
I mean, obviously no one's looking at that or looking to change, you know. Right. So what recommendation would you have for someone who's looking to have a lifestyle change and just can't do it, you know? I mean, what is the easiest way for them for them to fix it, should I say? Or start?
I mean, just start with something simple. Change the way you eat. Right? I mean, we have plenty of options out there. Yeah. I mean, you can go to, like we said, Chick-fil-A. You can go to Chick-fil-A and get grilled versus fried. I mean, it's small changes. Yep. You can get a salad instead of a burger.
Yeah.
You know, you if you really want a burger, take away the bun. Do a lettuce wrap.
You're right.
I mean, there are a lot of different ways.
I like that. Look,
but you have to want to do it. If you don't want to do it, then I mean, I can beat you over the head with all these different things. But you're not going to do it if you don't want to do it.
If you don't want to do it, I agree.
And unfortunately, in our community, it takes a life-altering thing to happen before you're like, oh, I need to stop doing what I'm doing. It's unfortunate. Instead of doing it beforehand, something happens and you're like, okay, I guess now I need to go ahead and do it.
Do you have a solution, or IV drip for diabetes, was being one of the leading diseases, and especially the African American, high blood pressure and all that too.
Well,
but
I think for
diabetes is like a silent thing.
Not really so much for diabetes, but more so weight loss with diabetes, right? When you look at like my different clients, they come in with the hemoglobin A1C, which is a culmination of what your blood sugars have been in over 3 months. Yes. Right? Normal is less than 5.4%. You have clients that come in and don't even know it. They're at like 10, 11, 12. Whoa. And then they lose 20, 30, 40 pounds and it goes down to 6 and 5. You know what I mean? So I'm like, diabetes is a silent killer, but you also have to be aware of what's going on with your body. Yeah. So preventative care every year, go get some blood work, go to the doctor, get blood work done.
But you know, Miss, we're not, especially men, they're not doing that.
They need to. I make my husband go. I'm like, it's time. You got to.
But you a nurse. You know, you got someone that's like, you know, like myself. I don't know. I just go. I'm like, I hope they go with me. You know, that's how I look at it. Like, I'm going to the doctor. You want to come with me, right? A lot of times people don't know dental health is a big thing too. Right. Do you guys do anything with dental, like whitening or anything?
No, I let the specialists deal with that. Okay. The problem I have with teeth whitening is if you're not a dentist and you're not looking deep down into like the gums. Yeah. I mean, you could have bad gums, but your teeth is white. That doesn't mean anything. You know, all your white teeth can fall out at any given day. Given day. So it's just kind of like at the end of the day, I need the professionals to do what they need to do. Yeah. Yes, go see a dentist. Okay, you don't have any cavities. You don't have gingivitis. Okay, now you can whiten your teeth.
Now you can whiten.
But nowadays they just offer teeth whitening, and it's like, okay, everybody can get it done, but it's just like, okay, your teeth are white, but like the core is like cruddy.
Yeah, your breath still stinks. All right. Well, right now we're at our moment where it's with the question of the day. We get a little bit more personal and stuff with you, all right? So I'm going to have you reach into this box.
I'm scared.
Don't be.
I'm scared. Oh, do you open it?
No, you open
it. Poly or monogamy? Lord. Definitely monogamy. Okay. I've been married 16 years. Yes, monogamy all the way through. Because I'm a Sagittarius. I will kill you.
You kill. Oh, she would kill you and nurse you back to life. Right. That's what she would do. Okay.
I will kill you and resuscitate you all in the same breath.
All in the same breath. Yes. Okay. What are your thoughts about poly though? Those who choose to do that. You know, it's becoming more common now.
We are living in this crazy world nowadays.
You notice that?
Like the things that flashed through me on social media, I was just like, I mean, if you like it, I love it. Okay. You know, if it works for you, I just know the type of person that I am. I'm not into sharing, so.
You're not sharing nothing? Not even my piece of cake. This is my cake. You get you another slice, the whole piece over there, right?
So I'm like, if you like it, I love it. You can enjoy that over there.
All right. Well, what's next for Miss Mellisa? What's next?
So what's next? So our goal is to, by the end of the year, have another second location.
Okay. Where have you already scouted out some locations?
Not yet. We literally so we've been open up almost 4 years. We moved from Alpharetta to the Beaufort area 2 months ago. But we are wanting to expand more north of Georgia because there's a lot of, what we do, there's a need for it.
Okay.
And there's not a lot of business in the north of Georgia, so I would like to bring that up there.
Yeah. I would think more in like in Atlanta, it's not too many, is it?
It's very flooded out here.
It is?
It's flooded.
Really? Okay.
You'd be surprised if you do your research and you look around. There's probably a wellness, or they call it wellness clinics, they call it med spas, whatever you want to call it.
Med spas, I've seen those, yeah.
Correct. So they're all pretty much interchangeable.
Do you, have you tapped into pain management?
I did look into it, but the problem with pain management, there's a lot of like red tape on that right now, due to like all the pill mills and the fentanyl overdoses.
Yes,
it's a lot.
It's a lot.
It's a lot, and I don't care.
It's money though.
There's money, but at the end of the day, all money is not good money.
All money not good money.
And with everything that's going around, you can be a diligent provider, but your clients can be over there doing whatever they want to do and your name is attached to it. Okay. I can be like, oh, you've had back pain, you've had a car accident, here's some Percocet, and they turn around and sell it to somebody else, right? So now, your name is tied to that and they overdose and die and no.
Have you ever worked with someone with after cosmetic surgery that did not make it, maybe didn't work out for them?
Luckily, no. I have not.
Okay.
I have not. Thankfully so.
Yeah.
But
so we've seen some situations, right?
I have been called into different recovery homes where their hemoglobin was like 4 and 5. I've had to call 911 several times.
Yeah, so when I'll tell you about my situation, that's how low my last situation was, 5. And they looked at me like, how are you even walking
How
around?
are you, right.
Like,
that is almost not
on?
Compatible with life. That's so low.
Yeah, they said, you're dead. Like, what are you doing?
Right.
And I was just moving, just keep going.
You didn't feel sluggish at all?
I felt very sluggish, but I had things to do.
Okay, yes. Superwoman.
Superwoman. So much to do. I felt it. I stopped at a quick clinic, urgent care, and I said, hey, I just need you to do some blood work on me. And she did it. She said, usually I don't do a rush, but based on your symptoms, I think you need to go to the hospital.
Right.
She got the results back in 4 hours, and she called me up and said, I'm like, I can't.
You gotta go.
You gotta go. I got there, and they looking at me, like I'm looking at them, and they looking at me.
Right.
And
I totally understand.
And I'm like, they was like, fine, what is wrong with you?
Right.
Like, I was like, I don't know, like. They said my body just started balancing out and getting used to it and stuff. By then, I was in there getting 2 pints of blood, iron infusion, and all that. And I'm taking the pills, but it's not working.
Are you taking them every day? Like
every single day.
Okay.
Trust me, they had me up in Jackson Memorial in Miami, and I would never want to exactly. And I looked at from that experience, and my life flashed before my eyes, and I said, yeah, this is not gonna work for me. I need to do what I need to do now.
Yeah.
So yeah, that was not it.
But yeah, I think I do recommend you going to get.
I should have had this call before you come. We could have been doing IV drip while I'm sitting right here. I could have been well. Like
that's what you need. You need a little B12 in your life.
I need a little B12. Okay, all right.
Yeah. So when you get back to Miami, look into that.
Okay. Well, thank you, Mellisa, for joining me.
Thank you for having me.
You were such very knowledgeable. I hope those who are listening, please get some insight on some wellness and some health and all that good stuff.
Yes.
And I appreciate you for just pouring out and helping those in the community that need you, especially after those surgery. I know it's not. Everybody has their opinion about it, and no one wants to touch it after someone else has touched it. But you're like, hey, I'll help. So that means a lot. It says a lot as a person for yourself, So it says a lot. So thank you for joining us today.
Thank you for having me.
You're welcome. Thank you guys for tuning in.